And for more on Korea's response to the MERS outbreak and what people can do individually, precautions they can take to protect themselves, let's turn to our Connie Kim, who is joining us in the studio. Thank you for joining us, Connie.
My pleasure, Daniel.
Connie, so mask sales have shot up due to growing concerns about disease transmission, and you had a chance to actually talk with some of the people. What did they have to say?
Right, yeah, well, anywhere in Korea, it was very easy to spot people wearing masks to stay away from the virus. Now, health authorities have said that it's very unlikely for people to contract the virus outside the hospitals where MERS patients are receiving treatment, but I guess that wasn't enough to calm public anxiety.
I'm a bus driver in Seoul. Since I encounter countless people every day, I've started washing my hands more often.
I'm afraid I'll get the disease. After I go into a store with lots of people, I always make sure to wash my hands.
I'm trying to stay away from crowded places, especially movie theaters or stadiums, just to be safe.
Well, Korea's infectious disease crisis alert level is currently at cautious, the third highest of 5 levels. Now, at this level, the government designates hospitals authorized to provide treatment for the disease. There was some speculation that the level would be raised a notch to a warning, under which an emergency response system is in 24 standby mode.
Well, Connie, speaking of alert levels, people weren't really happy with the government's initial response. It seemed a little lacking. And I've heard you got the chance to turn to experts about their views. What did they say about the government's response?
Well, a former director of the Korea Centers for Disease Control and Prevention said that the government actually did fail to carry out the appropriate initial measures. It actually took days for health authorities to detect the first MERS case. And making things worse, Korea wasn't able to quickly track down the people the first patient had contact with, resulting in secondary and tertiary infections. Now, but still, the professor says the country has enough treatment facilities to handle any new cases.
Looking at the number of infected patients, we have enough treatment facilities for MERS patients. Even if we see an explosive rise in the number of patients in the coming days, the country will designate more hospitals authorized to treat MERS patients.
Now, currently, there are 17 designated hospitals with special containment wards capable of blocking the virus's spread. Now, that's a total of 105 beds. Professor Chun added that containment and quarantine measures are the priority at the moment.
And how long will the outbreak continue? What did the experts have to say about that?
Well, it's too early to tell when the virus's spread is going to slow down, because May 20th was when the first MERS case was detected and when that first MERS patient was isolated. Now, the first 14-day incubation period for the first MERS patient has passed, but there are lingering concerns because secondary and tertiary infections have been reported.
I expect that this virus will be transmitted and have a circulation until next weekend. Because at the first time, the 2 weeks is a very critical time for the incubation period. However, now in these days, secondary and tertiary infection was identified and confirmed.
Now, until the outbreak subsides, experts suggest some things that people can do to protect themselves. They say people should wash their hands frequently because the virus can spread all over the body once a person touches their eyes, nose, or lips. Never wear the same mask twice. Now, that's because the mask could transmit the virus if a person comes into contact with someone who's infected with the disease, so discarding it is highly recommended. And people over 50 should avoid visiting people in the hospital, especially because people in that age group are more susceptible to the illness. Now, there was rumor circulating that said putting Vaseline in your nose is an effective preventive measure, but it's been proven false. And if you have symptoms of the disease, including fever or a cough, make sure to go to the doctor or contact the Health Ministry's MERS hotline for further instruction.
Right, it seems like it's always the most basic things that we need to keep in mind and adhere to, and not pay too much attention to those things that are not really being filtered through proper channels.
That's right, and thank you so much for joining us today. We appreciate it, Connie.
My pleasure.